So do chemical peels work for acne scars? And we see all sorts of chemical peels. There's the at-home variety, which tend to be weaker, hopefully weaker, because you don't want to be doing something too strong with your skin. Really strong chemical peels that can be done in a doctor's office under local anesthesia, and even some chemical peels that have required general anesthesia, like some of the phenol peels and things that are that strong. So do they help get rid of acne scars? In my opinion, I actually don't think chemical peels are the best way of getting rid of acne scars unless you do a special modification. And we'll talk about that. So light acne peels and light peels in general, I think they're great for texture. I don't think they seem to help with acne scars for some reason. Acne scars, I think, should also be called acne depressions. That's where the skin goes in versus like a raised scar. And because of that depth, I don't feel like superficial peels are going to really improve that texture to a significant degree where patients are going to see a big difference, especially if we're talking about like a salicylic acid peel or some sort of alpha hydroxy peel. The other peels you could talk about are these really strong peels like phenol peels. And again, I've seen lots of patients get full-on phenol peels and their skin hasn't improved that much. It seems to help better with lines and wrinkles than it does seem to help with acne scars. So what can you do if you are concerned about acne scars and you want to do a chemical peel route? Well, I think the best approach is to consider using something called a cross-TCA approach. And a cross-TCA approach is where you're going to use a sharp wooden instrument, which is going to basically poke into the scar, and you're going to dip this instrument into 100% TCA. Now, if you were to put 100% TCA on your entire face, you would be full of, basically you'd be in the burn unit. It's too strong. But because you're only putting this within the scar itself, it tends to have less issues. There's a modification of this approach, which is going to be called pinpoint irradiation, which uses a CO2 laser. I favor that over cross TCA. But that being said, if you're looking for a chemical peel solution, I actually think it's going to be 100% TCA with a cross technique.